It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hello, I'm Grace Sells, and welcome to another edition of Best Docs Network, featuring some of the best doctors in the Houston area that are changing lives. Up first, we're going to discuss heart health with interventional cardiologist Dr. Annie Varghese.
I came to see Dr. Varghese on the advice of my primary care physician because my blood pressure was a little elevated and my EKG reading was a little off. She suggested that I take a stress test and have some other procedures done just to determine the causes of that. And it was determined that I did have blockage in one of my arteries and a stent had to be implanted. And then reality sunk, and Dr. Varghese talked to me during the recovery time, and I asked her in tears, I asked her what was going on. I asked her, was I about to have a heart attack? And she said, yes.
Yolanda Garcia, to this day, she's so thankful that her primary care was cognizant enough to send her for evaluation, because many times primary doctors or nurse practitioners who see all of these patients, they may not recognize because the patient's not complaining much. So I think this is a wake-up call for all of us as physicians and healthcare providers to really focus on prevention, evaluating the patient early, getting them to the right specialist on time.
Because of her, I'm able to take care of my clients. Because of her, I have a better life. So I really am appreciative of all she has done for me.
Well, coronary disease in women especially is it's the #1 killer of women in this country, and pretty soon will be the #1 killer of women all over the world. And in Hispanic women especially, there's a high prevalence of diabetes. So therefore diabetes lends towards cardiovascular disease and coronary disease especially. It's just so important to educate our Hispanic population, our Indian population, because Indians die 4 times the rate of any other population from diabetes and cardiovascular disease. People are hungry for knowledge. It's just for the lack of knowledge we perish.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue. So they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body, and she thought, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get, a pouch and scar tissue buildup. So, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually it's what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. I feel sexy. I can wear a bikini, where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, I wanted to get back to me. I got my sexy back.
To check out videos on any of the doctors you've seen today and hundreds more, head to our website, bestdocsnetwork.com. Up next, we have gynecologist Dr. Farhina Imtiaz.
Even in 2013, stress incontinence and urinary incontinence in general is a very big concern for a lot of women. Often starts with childbearing, progresses as women get older, and by late 40s, early 50s, a woman may be noticing she's leaking urine when she coughs or sneezes, when she jumps, when she exercises, or for a lot of women, the problem is that she can't sleep at night because she has to wake up and urinate frequently. If you have stress incontinence, a very simple outpatient procedure will allow you the ability to exercise without losing urine and may free you from pads and diapers that you may be wearing. But just have to talk about it. In certain other types of incontinence, may require just medications to fill.
And Dr. Imtiaz can also treat her patients with a simple and common outpatient procedure.
So for urinary stress incontinence, my most common procedure that I do is something called a transobturator tape. It's a little mesh that's placed just inside of the vagina, and it sits like a hammock around the urethra. Urethra is the little tube that you urinate out of, and in stress incontinence, the control mechanism out of the bladder is weak. A woman doesn't have the ability to control when urine comes out. When we place this little hammock at the right spot, she will be able to hold urine and be able to cough and sneeze without losing urine.
Thanks to Dr. Imtiaz and these procedures, patients no longer have to live with this very correctable problem.
Now, the interesting thing is that even in today's day and age, women aren't talking about it, and it's a very common problem. And the funny thing is, it's a fixable problem, very easy fix.
I am an athlete.
I am a World Series champion.
I'm a hockey player.
I'm a football player.
I am strong.
I am strong.
I am strong.
Fight colorectal cancer demands a cure for colon and rectal cancer.
I'm strong because
I have lost a friend's mother.
Because I lost both of my parents to this disease.
I am strong because nobody should suffer. Let's beat this cancer. One simple test, and you could save your life or someone you love.
Get screened.
Be a part of 1 million strong.
I was experiencing a sinus, like an ongoing sinus infection for like the past 2 years. I was feeling congestion in my nose and ears and throat, fever, body aches, headache.
Alondra can't breathe through her nose. She feels pressure in her face, her ears, and most importantly, she had this constant postnasal drip that make her cough all the time.
Constant feeling like you're tired. You know, you're feeling like you've got to go to work, but you feel not 100%. And it would also affect my social life because I was always so tired out of feeling sick that I would just decide to just stay in and not really go out.
Upon examination, I noticed that her nasal cavity and sinus are completely blocked. She can't breathe through her nose, and decided upon a plan of treatment that consists obviously of allergy avoidance and allergy control combined with a turbinate coblation. It's a technology using radio frequency to reduce the swelling on the side wall of her nose, increasing her capacity to breathe through her nose and improving her nasal allergy symptoms.
After the procedure, I no longer experienced the symptoms that I was experiencing before. I noticed that I could breathe a lot better, like I just want to say I could breathe.
Alondra was very happy with the result of the treatment. We actually found the cause of the problem and targeted our treatment. Alondra breathed better, she feels better. It's a new person. Medicine has advanced so much that there's always a solution to breathe well and live well. Patient doesn't have to suffer anymore.
I no longer felt congestion. I wasn't getting sick every month because I no longer had that infection inside of like my sinus passages. So I want to say I feel great now.
Coronary artery stenting is a part of interventional cardiology that I absolutely love. It's been around for about 30 years now. Initially, the great giants of cardiology formed a cardiac stent, which is just a metal mesh that we place on a balloon catheter, place it into the coronary artery that's obstructed, open it up, leave the stent, and remove the balloon and the catheter. Easy procedure, but years ago it was quite difficult, and catheters were larger, there were a lot of bleeding problems, but now the catheters are quite small. The procedure is fast, done quickly and without much discomfort at all for the patient. If a patient presents with coronary artery blockage, they can go to the cardiac catheterization laboratory, have the coronary angiogram procedure done, and then if there's a blockage, we can place a stent right at the same time. Coronary stenting has protected many patients from going to cardiovascular surgery, has improved lifestyle, and many patients have gone without symptoms for many years because of coronary stenting. We thank the developers of coronary stenting, and we look forward to a future of great developments with regard to the coronary stent.
My legs were very, very tired. I couldn't sleep, toss and turn, couldn't get comfortable. They would just hurt, and all night for years.
Restless legs is best described as a very strong sensation or urge to move your legs. It becomes disabling because it creates an anxious sensation. It's hard to explain. You're not sure what's causing it. You just have this overwhelming urge to move your legs. It almost always occurs at night, and because of that, it creates severe insomnia and severe anxiety.
I had varicose veins. I knew I could see them on the outside. I didn't know about the veins on the inside that were not allowing the blood flow to go past my knees. That would just go up so far and then just go back down to my feet.
We mapped her veins very carefully using ultrasound. We again isolated all the bad veins, the ones that were too large and the blood was running backwards because the valves had failed. And then we selectively ablated those using radio frequency under ultrasound guidance.
No pain, just a little stinging when they first go in with it, but really not much, even though they say, well, it's not gonna hurt, it's not gonna hurt, but it really didn't. The last treatment I had, I didn't feel a thing.
And we do that without any incisions or anesthesia. The patients can walk in, sit down, have the procedures done, stand up, walk out, get in their car, and drive themselves home.
I would say don't worry about it, just do it. Just get it done because you need to have it taken care of. Sleeping now, I rest comfortably, and it turned out good.
In the past, we used surgical procedures. Problems with that: one, it required general anesthetic. Two, it required big cuts. with potential side effects like infection, damage to nerves, arteries, muscle, and they weren't selective. We were almost randomly choosing veins to treat, and they weren't always the only or maybe even the correct veins to treat. Now we selectively treat only the veins that are running backwards, so it works much better.
For more information or to check out hundreds of great videos, head to our website, bestdocsnetwork.com. And up next, we have Smile Specialist, Dr. Guy Lewis.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
You know, Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, you know, over the age of 40, who a lot of times, you know, they take care of themselves, they stay in shape, they look great, but there's just some things they want to do to try to look younger. And for Sandy, you know, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him, and I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener. He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. You know, what have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth, you know?
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
Patients often ask me how long they are contagious. Obviously, they don't want to expose other people to what they have. Well, for most diseases like the flu, bad colds, things with fever, you're contagious until the fever is gone for 12 to 24 hours. I usually tell people you can go back to school or be around people without putting them at risk once you haven't had fever the night before. So if you don't have a fever after 6 p.m. at night, then the next day you can be around people. Now, the problem is you're probably contagious before you get the fever with many illnesses, maybe 10 to 12, maybe up to 24 hours. In chickenpox, you may be a couple of days before the chickenpox breaks out or gives you a fever that you're contagious. But for most diseases, it's that 12 to 24-hour routine, so that's when you want to stay away from people. Now, there are other things like hepatitis. Those can be contagious for a long time, a couple of weeks before you even know you have it, and even for months and years afterwards. So ask your doctor about those particular diseases, but on the others, just use that rule of thumb, 12 to 24 hours.
Did you know that on our website, bestdocsnetwork.com, you can request an appointment with any of these great doctors that you've seen today? Let's take a look at our next doctor, gynecologist Dr. Meredith Morgan.
Prevention and therapy of osteoporosis is one of Dr. Meredith Morgan's specialties. Dr. Morgan offers some suggestions that could help prevent this disease.
If a woman's normal, a healthy lifestyle should be adequate. The question about diet, nutrition, and exercise, part of life would be an active lifestyle. Weight-bearing exercise, say 5 times a week for 30 minutes, is good for cardiovascular, and it's good for the bones. So walking is great. So if a person can do that, that's the ideal for the bone health. Therapy is indicated on a risk factor. If there's been a fracture, it's obvious the disease exists. If there has not been a fracture, but the absolute risk projects to over 20% for a major fracture of the spine, arm, wrist, or a 3% 10-year risk of the hip, then drug therapy is indicated.
Dr. Morgan can adjust his treatment depending on his patient's lifestyle.
There are basically 2 groups of first-line therapy. The bisphosphonates, to use a big chemical phrase, and denosumab, which is a type of immune therapy. These have been proven to be effective and significantly reduce the risk of fracture. Highly, highly preferred to obtain our calcium in the diet. Just make it really short and easy, about 1,200 milligrams of calcium a day. In terms of nutrition, this is very serious. There is controversy, but there's enough evidence to indicate that a person who tries to treat osteoporosis only with calcium supplements or calcium and vitamin D supplements may have an associated 30% higher risk of having a coronary event, a heart attack. It's mainly theory as to why this would happen, and there are some people that don't believe it would happen, but in terms of the alternative managements of the disease or the high risk, we're talking about nutrition, supplements in a reasonable dosage, and the lifestyle of exercise and fall prevention.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
In today's Ask the Doctor, Ricardo from Houston has a question for Dr. Annie. Do all heart attacks cause chest pain?
That's a fabulous question. Very important for people to know that 50% of the time, people with coronary disease don't even have chest pain. They don't have any symptoms. So sometimes people can have a heart attack and not have chest pain. Sometimes people can have chest pain but not be having a heart attack, but just have something called angina, or decreased blood flow to the heart. Whatever the symptom is, whether it's chest pain, shortness of breath, palpitations, just a funny feeling in the heart, oftentimes women may say that they just feel less able to do the things that they do, less able to take care of the things in their household daily environment. So if people have symptoms, definitely they should be checked. If they don't have symptoms, they just are worried about heart attack or stroke or family history of heart attack, just go and see your doctor. Every physician is able to evaluate the heart. You don't have to go to a cardiologist. You can start with your primary care doctor that can give great care, and then go and see a cardiologist for further evaluation.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and of high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Janice was experiencing a lot of problems with her sinuses until she met Dr. C.T. Nguyen. To hear more about Janice's story and hear other life-changing stories, log on to bestdocsnetwork.com.
My symptoms are, I don't want to walk on the ball of my foot. It shoots sharp pains up my leg. I mean, it feels like a nerve's being pinched off.
Wanda's a patient that presented to my office complaining of shooting pain, down her heel, upper leg, and so immediately I started thinking maybe there's a possibility of a nerve, compression.
I told him my symptoms. He suspected what it was. He wheeled in a little mini ultrasound machine, did it right there on the spot, and diagnosed the problem. And we set up surgery because I had already tried other treatments with other doctors and it didn't work, and we were done.
This is your ankle joint, and you have a major nerve that courses through here. There's a natural tunnel. It's called your tarsal tunnel. What happens is the tunnels get real tight and they clamp on the nerve. The protective covering, which we call the flexor retinaculum, the nerve tends to get stuck underneath it. So what happens is when the nerve gets compressed, it's extremely painful.
What he's trying to do is avoid that numbness, and for most people it works. You basically take what's pinching the nerve off away, and you make room for it, and life goes on.
And the advantage of this is it's not a surgery where you're really held up for a while, where you have to, stay at home and you can't put weight, because I want the patient walking as soon as they can, because I don't want those tunnels to tighten up or to close up. So I want to make sure the nerves can glide. Wanda had tarsal tunnel surgery. She comes back to the office 3 to 5 days later, and just dressing change. No need for x-rays because we're not doing any bone work, which is great too, because if you're not doing bone work, it's not necessarily as painful. There's less swelling. And so 2 weeks later, sutures are out and she's walking on her own.
I'm very happy. I've actually recommended him in all my friends that have gone to him, and they've had more extensive things done to them where, you're reattaching muscles and putting in screws, really crazy stuff. They also think he's awesome.
The side effect that one has from nerve decompression is not pain, it's lack of sensation, it's numbness. And that's temporary because with time they regain their sensation, but it's a really easy recovery and it provides immediate relief.
All right, that's going to wrap up today's episode of Best Docs Network, featuring some of the best doctors in the Houston area that are changing lives. For more information or to check out any of the great videos you've seen today, head to our website, bestdocsnetwork.com. And if you have any questions or comments, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. All right, we'll see you next week.